Good morning, everyone, and welcome back. It feels like a long time since we have been together, but we're delighted to invite you back to talk about our next community conversation with Dr. Dale Reisner on behalf of HealthAdvocateX. Just a reminder to folks, please put yourself on mute as Dale's going to give us an overview, and then she'll answer your questions. And this particular call, like all of our calls, are being recorded and it will be available afterwards to listen to again or share with your clients or your colleagues. Today, we're going to be talking about updates on COVID-19. And just a reminder too, that we will be recording. So if you don't want your video to be shown, just go ahead and turn your video off. And with that, I'd like to turn it over to Dr. Dale Reisner, who is board member at HealthAdvocateX and also medical director of OBGYN Health and Safety at Swedish Health Services. Dale?
Hi. Well, hi, everybody. And actually, it's nice to have a little bit smaller group because hopefully we can have some open discussion at the end. Although by the time we got through talking about the agenda, there's a lot on it. So we'll see how it goes. As always, put your hand up, put stuff in the chat box. Robin will field things at me as needed. So I will start with just a tiny bit of kind of where we are with statistics, but not really focusing on that today, more on vaccination and variants and a number of things like that. So in the world, there are over 176 million cases, and there are 3.8 million deaths reported. In the US, we're greater than 33 million cases with over 600,000 deaths. And in Washington State, just to bring it down to a reasonably small state overall for population, we are at 445,000 cases with a little over 5,800 deaths. So definitely it's ongoing. We are now seeing places across the country where there are still cases, but no deaths. Inpatient ICU days have gone down quite a bit, which is awesome because there's less risk for people who need the ICU for other things. And it also speaks to how we're kind of working through the more serious cases in some respects with the vaccination. And we'll talk a little bit how that is working. The vaccination rates are really different depending on what state you're in and what country you're in, and even whether you're rural or urban. And Washington State is a really great example. Along the I-5 corridor, which is north to south, we have very high rates of vaccinated people. And my dog is confirming that. And check, go lie down, go on. And the rural areas, we have had, good heavens, come here. We've had people who were offered vaccine and declined in some rural areas, and we also had slower penetration. In Washington State, there was an initial attempt to get as many people both doses of vaccine as possible. And when you look in some other states and certainly in some other countries, the approach has been getting the first vaccine dose into as many people as possible. And it's worth talking about that. I know there was a lot of discussion with public health officials in the US about what made the most sense, full vaccination or partial. And that in most of the country, that's been the biggest effort in the US. We have 143 million people in the United States that are fully vaccinated. So that is not quite 44%. That's actually not bad considering how huge we are. But there are pockets where there are hardly any vaccinated. And of course, it depends on the age. So if you look at the 65 and above, really high numbers, even in the 50 and above, higher numbers. And then as we get into the young adult, and certainly since we're now just opening it up to kids, fewer there. But if you compare the US to India, and if you've been looking at the news at all, India's in a really bad spot with high cases, high death rates, very severe infection, probably due to one of the variants that's out there. However, they have a 3.4% vaccination rate in all of India with a massive population, right? So there's
so tough.
46 million people that live in India. And so that's an impossible situation, right? It's very scary. And so you see, and this is not a political statement, but if you look at the G7 meeting that just happened, every one of those industrialized countries are now making a commitment to help get vaccines to places that have not had the ability to even vaccinate their highest risk, their elderly population, or those with underlying conditions. So
I have a question that I hadn't seen addressed before in countries like India. Do they even have enough vaccination to vaccinate their healthcare workers in those countries?
I don't see any reports that their healthcare workers are covered properly either. That's right.
Yeah. That's so tough.
Yeah, it's super tough. And of course, they have this massive demand. They're running out of oxygen. I mean, it's just so sad. We, I think, as a population, need to think about how we help some of these other countries. And you may or may not be fully wedded to vaccination. And if you don't, then you're making your own choice. And some people, really rare that you shouldn't have it at all, because even reactions to other vaccines are not applicable, especially to these mRNA vaccines. But when we have whole communities where people are like, I'm afraid of it, I'm not doing it. It's really interesting. I heard an NPR conversation in a rural community where they were talking to people, and they actually got kind of a discussion group together and shared input and so on. By the end of that conversation, some were now considering, weren't fully addressing it. And one had decided that had been on the fence, had decided they were going to go get vaccinated because they were able to, in a small group, kind of dismiss or at least shed light on some of the theories that people were worried about. But how do you do that with a whole country? And nobody trusts the news. This only works when you're together with other people of like minds, and you can have those personal conversations. So I think one of the things that I will end with, but I'm just going to mention now, is when most of who is vaccinated, or you yourself is fully vaccinated, what's comfortable to do. And a lot of that is going to be based on your individual health risks, who you then going to go visit, like are going to be around your elderly grandmother who may have been vaccinated but still could get sick. And think about those kinds of things, because none of this is going to get fixed in any short period of time. The other thing is that Canada and the UK both have been functioning on the approach of get as many people the first dose as possible, and then delay the second dose and catch up with it later. And so you might wonder if it's working, and it actually is working. In Canada, I focus on Canada because I'm Canadian born, but I also have my youngest son up there living and my oldest relative who's 93 years old. So I pay a lot of attention to what's going on in BC. They have first dose in 65% of the population in Canada, which is pretty
In
amazing.
all of Canada?
Yeah. Yep.
Oh, I didn't. Wow.
And
that is
but
amazing.
only 12% has had both shots.
Mm-hmm.
So my youngest son, he's 31. Yikes. And he just got his first dose and has been told it'll be months before in fact, he's probably going to come down to the States and get a second dose just because he wants to be fully vaccinated. And he might want to see the family that he hasn't seen for a year now. But
and is there any good data? Because I have heard of people getting COVID in between their first and second dose. So is there any good data about that gap time?
So that, yes, there is. And I could give you, if I had the right reference, which
and
I don't
didn't, I know I didn't ask you that in our prep, so
I actually did. Yeah, I actually did look at that because in the United Kingdom, they're also delaying the second dose. So in Canada now, 4.3 million people have received at least one dose. And in the UK, they are delaying the second dose, and they actually have seen a reduction in deaths by 20%. So what you get after the first dose with Pfizer or Moderna, for sure, because we're talking about 2-dose vaccines here, is around 60 to maybe 70% effectiveness with your immune response. So when you think about that, 60 or 70%, it may be less severe and also less risk of catching it in the first place. You're going to reduce the death rate. So that's what they're seeing already. And they're actually, what they say is it works really well for people under age 65. Those who are older, they are getting, their vaccines more consistent timing. And so they're aiming for the second dose for everyone by 12 weeks out. And there's actually a little bit of theoretic data from modeling studies and things like that, where actually if you get a chance to mount your immune response and have a little bit greater delay, then that second dose may actually boost it even further. So I don't know whether people have actually been able with this vaccine to prove that, but we've seen it with other vaccinations. So
interesting.
Yeah. So I think that we still have a lot of work to do with the vaccines. The other thing, while we're talking about vaccination, is who's getting sick. So if you have been fully vaccinated, nothing's 100%, right? So nobody really knows the information on if you're vaccinated and you get COVID, how infectious you could be. But honestly, to me, it seems like if you've got the disease in your system, you're going to be infectious. To me, it does not make sense to think just because you've been vaccinated, if you get sick with something, when you get the flu, like you got the flu, just because you had a vaccine doesn't mean you're not going to give it to your spouse or your kids or your whatever.
Yeah.
So there's no data on that, but I'm not expecting that that's going to be any different. So I think we have to think about that wherever we go. And if we do get mild symptoms now, one of the things I think that's going to happen, if what we get is a milder disease, are we going to recognize it for what it is? Are we going to think it's a common cold? Are we going to think it's my year-round allergies that, flare?
Right.
Yeah. Mm-hmm. Yeah. So that is a really good question. So they're calling these infections that happen when you've been vaccinated breakthrough. And we know that the variants that are out there are highly infectious. And so you're probably more likely to pick up one of those than, the original batch. Both Pfizer and Moderna have been looked at with the ability to avoid serious illness with these variants and seem to be working quite well.
Do we know, and it seems to me that we don't quite know how long the vaccines last, right? So
right,
if you got
right.
your vaccine in February, which I know a lot of the people on the call were early to get their vaccine,
Mhm.
how will we know, like
Right.
how will we know when that is starting to fade? And are
Well,
there,
you're probably going to be offered a booster type vaccine in the fall.
Mhm.
And some of the companies are working on combo flu COVID vaccines.
that would be
And
nice.
yeah, and the ones that were out of the gate right away, Pfizer and Moderna are already working on enhanced vaccines that will have address some of the known variants. We're going to continue to get variants because that's the way the coronaviruses do it all the time. That's why we don't have a vaccine for the common cold. It's typically not severe and it's
Mhm.
mutates all the time. So the those are happening as we speak. They're already working on enhanced vaccines. So that's great. And they're actually testing them. So they've got them developed enough that they're testing them in populations where there are variants more commonly. There's been a little flare in British Columbia, for instance. They have a P variant, whatever the number that goes with that. I mentioned the variant in India is quite prevalent and seems to be causing a lot of turmoil. And many of these variants are more infectious in that it's easier to spread. So I think, again, those of us that are vaccinated need to be cognizant that if we get something like that, that we need to pay attention and go get tested. I think just think about getting tested if you're at all worried. There is a new vaccine that is US made. The company's in Maryland called Novavax. They make other vaccinations, but it's supposed to be 90% effective against moderate or severe disease. So we'll see that roll out as well. These companies that were working on it and weren't the first out of the gate are going to continue to fine tune their products, and there will be more available. So that'll be good. And so I think we'll see a lot in the next few months about vaccines, the variant coverage, and those kinds of things. The only data I really could put my thumb on, and it came from a local paper actually in Maine, was in the state of Maine, and I don't have a number for their total population. They have 8 fully vaccinated deaths from COVID in the state
Wow.
of. And I heard a report the other day of one somewhere, and I didn't realize till I just did a Google search for deaths in vaccinated people, and so they were all either elderly or some other underlying condition. So again, it really does, I'm going to sound like a broken record, but it speaks to who we get around, if we have any symptoms, or to really maybe, for a longer period of time wear your mask out in public than you would.
Well, and I think it also speaks, and I know we're going to talk a little bit about how does this information impact what we do, in terms
right,
of our behavior. But I think it just speaks to kind of a hyper vigilant, thinking about we could still continue to get this. So like I was at a boating event this weekend, and there was a potluck, and
mm.
it was outside, but I
It was a
just,
potluck. Yeah, yeah.
it just made me
I
really
know.
think what are the risks, how do I navigate this, maybe not eat other people's food, I don't know.
Yeah, yeah, yeah. And yes, and I went to a wedding in Winthrop last weekend, and a lot of young people that were not getting vaccinated at that
Oh.
wedding.
Mhm,
Everything was outdoors, and there were servers, and so you
mhm.
could just, nobody else was handling the food. But and we ate under tents. But even at that, when I was around in the town, there were so many anti-vaccine comments that people that lived there were talking about. I'm like, I'm wearing my mask everywhere.
Yeah.
Yeah. So
And
you
I'd
do
be
need
really,
to think
I'd
about
be
where
really curious for the people who are on the call, if they're encountering with their clients or
Mhm.
family members, the resistance to vaccination and how you're dealing with that. I'd be curious to know if you want to put that in the chat or as we're
Yeah. Yeah.
going
Right.
along here.
Right.
Mhm, mhm.
Yep. Um, so I think that the other topic we were going to touch on briefly, and we had a wonderful talk on long COVID syndrome, but we're starting to see more of this in young folks. And we're starting to see more of the viral myocarditis, so inflammation of the heart in young folks as well. So that always has to be a consideration if somebody has prolonged symptoms. And that what hit me was just an individual report on a young gymnast, really fit young woman. I think she was either teens or 20, who got COVID, quite mild symptoms, started getting better, and then just like never, she got worse. She got kind of a lot of fatigue and shortness of breath, and then that shortness of breath seems to have settled down, the fatigue, and then bad headaches, and just all these neurologic things, where she really feels so weak she can't walk any length of distance. And this was someone who was like on a balancing beam,
Yeah, athletic. Yeah,
very athletic,
athlete.
very fit, normal BMI, all of those things, no underlying conditions. So there's a whole bunch of articles now about athletes and those who have prolonged symptoms and so on, and people who you wouldn't expect to be at risk to get the severe illness and die, and may not have severe symptoms in the first place. So I think we have to be a little concerned about the younger folks in our communities that have been a little resistant to wear masks and want to, so the socialization, we all feel it, but it hits them harder. That's part of your youth, right? Is hanging out with your buddies and having parties and getting together and all of those things. And what risk are they putting themselves at with the kinds of behaviors that they want to do, and thinking that they're kind of impervious, which is an adolescent approach to life anyway, right? Yeah.
Right.
Young
And so
adults.
what you were saying is, even if as a young person, as an athletic or athlete level person, you get COVID, and even if it's mild, what we're seeing, and we don't really know the stats overall because maybe we don't have enough experience, but it can turn into something very serious later.
Right.
And
we know that so like in the US, if we're looking at the vaccines, who's been vaccinated the most, right? We know that that's it's for a population of 65 or greater, out of that 40% of the whole population, 82% of those of us that are 65 or older have been fully vaccinated in the US. That's pretty awesome. And 63% of those who are 50 to 64. So pretty good there. 42% for the 18 to 49-year-olds. And, most of that will be the kind of closer to the upper 40s. And most of those are people that are either healthcare or, exposed at work or, essential worker or things like that. So there's a lot of younger folks that either have chosen not or haven't had the opportunity to get vaccinated yet.
Yeah. We have a question from Julie Forkesty. Thanks, Julie, about vaccinating little kids 2 and older.
Yeah. So the Pfizer vaccine has the most experience with that. We'll see more rolling out because there's ongoing trials with young kids. And it appears to be safe. they're having the same sort of side effects that we do with, pain at the injection site, so on. No, dogs don't get vaccinations. Yeah, I'm sorry.
Chip.
You need to lie down. We're busy.
We could probably all relate.
Yeah, I don't have the kid, and this guy usually is very quiet. Come here. Come on. So yeah, he thinks dogs can get COVID, so he should have a vaccination. So yeah, I think that we're going to see more and more data on that. But what is out now, it looks as safer as some of the other populations. So I'm going to go on silent for a second.
Okay, I haven't. Yeah, and I do have another question. It came up from Julie Glendening. I hope I said that right. That because I was asking about whether or not you're finding people resistant to being vaccinated, and what she said, and I've heard this too from some family and friends, that they feel like they've already had COVID, and so they have natural immunity. So there's really no reason to get the vaccine. Dale, can you comment on that?
Sorry, can you just repeat the last part of that question?
Sure. So, so some people, this question came from Julie Glendening. Some people say that because they think that they had COVID, that they would have a natural immunity and therefore don't need the vaccination. So can you comment on that? If somebody's already had COVID, do they really need to have the vaccine?
Based on the initial antibodies studies that were done last year around this time, where there were more people showing up with confirmed infections, it is pretty clear that we don't have long-term protection from the wild virus. Some people, it went months and months. Some people, I think the shortest I saw was 2 months. 2 and 3 months. Yeah.
Wow.
And that's based off, there was somebody, I think there was somebody either on this call or that reached out to me afterwards that had a relative that had the wild disease, was donating plasma, went back in a couple of times, and then was told, you don't have detectable antibodies. So we're done. And it was within, I don't know, 4 months. And that's person got another infection. Actually, it was before the virus came out. So
wow.
Yeah. So I think that getting vaccinated, typically what I'm hearing recommendations from public health providers and from the CDC is about a month after a COVID infection, consider a vaccine. Certainly within 3 or 4 months, it would be reasonable if you don't want to do it right away.
Mm-hmm.
So
are they doing any clinical studies to look specifically at people who'd previously had the wild type and then go ahead and get the vaccine versus not, and infection rates and that kind of thing? I haven't heard anything about that.
I don't think there's any studies. The people that had the vaccine, that had the wild virus and then got vaccinated, though, we are accumulating some data through the CDC's website from if you made that connection and did the Be Safe program, they are collecting that data. We have a lot of data collected that way, also from early pregnancy exposure, where women were getting vaccinated and didn't know they were pregnant yet. So there have been some worries in pregnant women about what if they got the vaccine and it was the first trimester or something. And what we are seeing so far is not a problem. So lots of, we've gone nationally in the OB population from recommending a discussion with your provider to actually really encouraging women to consider vaccination, because as we collectively got more data on pregnant women outcomes, across the country, it was clear we had more ICU admissions and probably slightly greater death for age based on, people that were the same age group. And that is not surprising because most viruses do that. Severe response because you're a little bit immunosuppressed when you're pregnant. Otherwise, you would reject the fetus. So that's a thing that has to be. But yeah, if you get those things, you tend to get sicker on a population basis.
Mm-hmm. And is the virus, the people who are getting the wild virus, turning on other issues? Like I had heard that the wild virus is turning on autoimmune issues in some people.
Yeah, I think that's what long COVID really is.
Mm-hmm.
I was thinking about this. We know for type 1 diabetics, especially like childhood onset, things like that, that there certainly are genetic tendencies, but not every, child in a family that has a genetic tendency for diabetes is going to get type 1 diabetes. And we've been aware for a long time that something simple like a common cold or flu or something like that can actually probably trigger that autoimmune aspect of what gives somebody diabetes if they're prone to that. And we think that may be the case with some juvenile arthritis, and lupus is another one where there's really thoughts that what triggers the immune response in the first place for a viral infection just doesn't get turned off, and that becomes more displaced cell types that the response is, even though the virus is no longer there, or the virus was maybe never targeting those particular cell types. So that makes sense from a theory perspective, because we know that there are other autoimmune disorders that probably have been triggered by some sort of either stressor or a viral infection.
Yeah, for sure.
Yeah.
And we have this question from Anne Brunt, or Brunt. Do you know about vaccine effectiveness in people with cancer and the immunocompromised? My research so far doesn't have definitive information, but I've seen they aren't responding as well. It's interesting.
They probably aren't. This is what I've seen as well, and they probably are not mobilizing the same degree of response. However, there's still a recommendation that they get vaccinated. So even if you say you have 40% response, is better than zero response. So the only people that are absolute no's are people that have had, when we're talking about mRNA vaccination, so not, it doesn't have some other component that a prior vaccine might have. I don't know if it's applicable to the Johnson & Johnson vaccine or not, but for the two mRNAs, the Pfizer and the Moderna, that the only contraindication to vaccination is if you had an allergic reaction, not a side effect, anaphylaxis to the first dose, then you don't get it again. But there's very few absolute indications to not. Now, there may be individual providers, physicians, nurse practitioners, whatever, that are hesitant to have or recommend vaccine to some patients with chronic illness. But overall, probably your risk is greater from the virus than from the vaccination.
So Lisa Casaro has this question. I've had people ask me, so I'll ask here, why wouldn't we respect the right for people to do what they want with their bodies in terms of this vaccination, just as we are asked to uphold that right for other medical decisions and treatments, other vaccines, surgeries, your thoughts?
Yep. And we must. Where there is room is when people are not fully informed, have misconceptions, have just basic fear because it's new, because it got processed quickly. There's a lot of that.
Mhm.
And we give them information, the success rates, the effectiveness rates, all of those things, comparisons, not the long COVID syndrome, but some of the more serious complications, like in the population, the small percentage that had clotting issues, blood clot issues. When you look at the percentage of those compared to the risk of death by not being vaccinated, it doesn't come anywhere close. But somebody may rather take the risk of death than the risk of this rare clot. And that's up to them. That's totally up to them.
Mhm.
If the whole population does that, then some of us are going to die because the whole population is thinking that same way. If there's small areas that don't want to, I'm not going to go visit that town if I know that, because I don't want to put my own self at risk. But that doesn't mean that they shouldn't do what what they decide to do. So I agree. I would hope that there is a piece of the people that have been hesitant to vaccinate. And what I've heard more is that there are some people that want to wait a longer period of time to see how everybody else does with the vaccine.
Mhm.
And many of those people do that with anything new that comes along. That's they're not the first adopters. They want to make sure that all their neighbors have been through it and nobody's had a bad thing go on. And
Mhm.
and people are certainly, have the right to do that as well. Yeah.
Yeah, I wanted to call on Michelle Riddle because it sounds like in her client population, I was just curious, Michelle, what your experience has been.
Yeah, so what I put in the chat is I've got currently 27 patients and only one has been vaccinated. As an advocate, we give them the data that's available and have them communicate with their providers and then decide on if they're going to move forward with the vaccine or not. And then as an advocate, I have to respect, their decision, but they have all the information, in their at their fingertips type thing. And the one thing that I hear over and over and over again is that if there's anything negative about this vaccine, it seems to be swept under the rug or censored, or it's always removed. And we all know anything and everything in the medical industry, there's always going to be the good, the bad, the ugly.
Right.
And so it's always available. And when it's not available, it's for the patients that I have right now, they've got, the red flags. It's like a warning sign. Because they don't understand why they feel that the data conflicts, which is, we've all seen it. It's kind of gone back and forth. And so it's very alarming. And, I keep my personal opinions out of it because that's not my job to give them my personal opinion. It's for their providers to give them their professional opinion and then for them to make their decision. But yeah, I hear it all the time, and it's very, very concerning.
What data are you referring to that you feel is changing?
Well,
I know opinions have definitely changed.
Yeah, opinions. The data on, I know that you just stated that if you had an anaphylactic reaction for the first dose, not to get the second dose. That's definitely understandable. But I think there's other reactions out there that have started to come out, but they've not come out. And if they have come out, they're not necessarily talked about. And, an autoimmune response, I've got multiple patients that have an autoimmune condition that, there's nothing that they can do. There's no cure for it.
Right.
So, so they look at, okay, do I really want this, or do I want, to, take my chances and, get the virus, see what
Sure.
happens. And so I think there's, oh, we have a question. Nancy?
I'm sorry, you don't have to stop. I was just gonna up next. I live with
Oh.
a chronic condition. So anyways, you can continue, Michelle.
Yeah.
Okay. So, yeah, so it's just it's a concern, and unfortunately, and this is the huge, elephant in the room. It's politicized. So you've got
Yeah.
both sides
Yeah.
saying something else.
Yeah.
And unfortunately, it's not the actual, here's the situation. It's blown out of proportion on this side, blown out of proportion on this side. And so when you hear all of this mixed communications and, it's just a lot of noise.
Yeah.
And as
And I think Chris Van Haren actually just put something in the chat that I think is very apt, which is the general public is not used to seeing scientific research happening real time, like COVID.
Yeah.
And so it's interesting that, the scientific process being brought into people's awareness. And that's actually one of the reasons why we're doing these COVID conversations, these community conversations, is to try to sort through the data as it's coming out. And we're grateful, Dale, to provide that.
Well, and
Nancy,
just,
go ahead. Beth.
just like, anything else, just like people signing up to get vaccinated, if they're not using the V-Safe and we're not collecting data around what the reactions are, we don't have, real-time data, and we won't for a long time. I mean, normally when something is new like this, it takes years, at least 6 years to get actual data.
Yeah.
But I think, what we're seeing, you got to look at, there are actual deaths, as opposed to what we're seeing as the reaction. So, I mean, I think for Michelle, for your clients, that's one of the things that would be great to, and I'm sure you're providing that, but, here's what we know. You're going to go in the ICU and die if you, many people, if you get COVID. And with the vaccine, that's not what we're seeing. So,
and I understand that, but I've also had, patients that, they just, you wouldn't think that they would survive COVID, and they did. And so there's not a definitive, if you have these conditions, you definitely need to be vaccinated. Or if you are a healthy individual, you don't, or you are a healthy individual and you're playing, Russian roulette. So I think there's no rhyme or reason. And I understand that, medicine is definitely that. And also that we don't have the data. So, I think a lot of these patients are thinking, gosh, I don't want to be a part of, the experiment of getting this vaccine and it not working for me, because most of my patients are extremely ill and they don't want to add something on top of what they already have. Does that make sense?
Yeah, and that's fine. And you're exactly right. You cannot tell. So you can't, this long COVID syndrome stuff with some of these young, healthy people, you wouldn't have thought that those people would get sick or be chronically ill. You wouldn't, we know the wild virus does that to some people, but you can't tell ahead of time. You can tell certain things that if we look at everything we know about the COVID-19 wild virus, we know that if you're elderly, you have a higher risk of death. But just because you're 83 and you get COVID doesn't mean you're going to die. So, but it's that same way with every disorder that we see and every infection that we see. You have people that get septic with bacteria. some will survive, some will not. There are things we can do to treat the bacteremia and, help you survive. But we can't guarantee that every single person that we do the exact same treatment for is going to make it through. So, and I don't think that we should argue with people about that. And I do think that really the approach in your patient population is to say, fine, wear your mask, stay away, wash your hands way more than you thought you ever needed to. Don't ever get in close. We know that even with autoimmune disorders and other illnesses, don't get in close, large populations of people that you don't know, because you don't know if they've got a infection or whatever. And we have people that are in denial that have the illness. So we have people that come into the hospital and you ask them, have you had a cough, a fever, whatever? They say no. And then in the course of their care, they're coughing and they're going, oh yeah, I was doing that at home a few days ago. And you're like, oh, where have you been? And you now just exposed X number of people. That's super rare, but humans have a denial thing that's built into us. Yeah, it's never going to be me, right?
Okay, but Dale, I have because we're not even allowed to have allergies. We're not allowed to have a cold. We're not allowed to have the flu, because if you have a cold, everybody thinks, oh, you have COVID. So it's like we're not talking about everything else that actually exists. So how do you live? I mean, my patients are going, we're going to appointments, and the providers, they're not wearing their mask. They're not,
They're not.
No, they're not wearing. They're
Wow.
no, and they also stated that it's extremely important to have a healthy immune system, and to not be so locked up, and obviously good hygiene and taking good care of yourself. But I think you're seeing both sides of the spectrum, and it's really difficult to to guide. Well, we're not even
you can't make sense out of that if people are talking out of both sides of their mouth. So yeah. So I wouldn't just support them for what they feel comfortable with doing, and then at some point some of them may decide they want vaccines, some of them may not, and that's okay. The thing is, as you said, you're an advocate for where they're coming from. You help them understand what's available. The CDC does start publishing a little more of the V-Safe data, that it'll be on the site. And, now for somebody who doesn't trust anything coming out of the CDC, then there's not much you can do there. But I do feel like the current folks that are running the CDC have tried to be apolitical. They've said that out front. We are being scientific. You can't tell me what I'm going to publish or not. And I think there is some hope to sort of reinvest in that. And I really trust my public health officials. They are always looking for the science and what's right in terms of the data. And they don't get into the, which side of the aisle you're sitting on stuff, which really shouldn't be in healthcare at all, as far as I'm concerned.
Yeah.
But
so
but Nancy, you had a comment or a question. I want you to speak. Yeah.
Yeah, thank you. Michelle had just mentioned something about chronic conditions. So I've been living with MS for 27 years. Always kind of unpredictable. You just don't know. Even the medications, you don't know if they're working or not. But I'm on Ocrevus. It's an infusion every 6 months. And I did get my vaccination. My second dose was April 9th. And I'm thinking, I'm fully vaccinated, everything. I had a doctor's appointment and I said, can I be tested for the antibodies? And he said, well, on Ocrevus, we're seeing that Ocrevus is killing the B cells, and the Pfizer vaccine works off the B cells. So you probably don't have any immunity. And I was like, how come this is the first I'm hearing about it? I mean, it is what it is, but I probably only have 20% immunity. So I wear my mask everywhere. People don't understand, and no one has to, but we don't know what each other's going through. But Dale,
Yeah.
thank you so much for your information, because I watch things like this that I trust, and all you people with your information. Because someone wrote on the internet, there's all this stuff. I mean, so thank you so much for hosting this.
Oh, you're welcome. And yeah, we try to be really, really honest. And I look at resources, if it's something that I haven't already come across, that are trustworthy, and I'm not getting it off Twitter or any of that kind of stuff. Yeah. And I do try to present realistic information, like the deaths when you're vaccinated. It's not, nothing is 100%. And who knows, right? You cannot be vaccinated and get the disease and be totally unscathed. I mean, I personally think I had it last February, before we could test anybody, and before I was able to really get in and see if I had antibodies. And I'm old, and I didn't have to be admitted. And, I fortunately don't have any significant underlying conditions. So I have some mild stuff. And so maybe I was just lucky. Who knows? And I think we have to live our lives as individuals. And then in the advocacy community, we have to help people do that. And if you find somebody that you're advocating for that really doesn't have all the information, then you're providing an educational service as well, based on what you trust as the advocate, right? So you have to feel like you've got some sources that are reliable.
Mm-hmm.
Yeah.
Judy Finn asked a question a while back. What's the impact on the medical care system of patients suffering from and being treated for long-term, long hauler effects post-COVID recovery? What do you think we'll be seeing, or is it too early to know?
I think it's too early to know. And there's a lot of talk about it. And the symptoms are very wide ranged, as you might anticipate with anything that's autoimmune. And we don't know even if it'll burn itself out. That's a possibility. There are exposures.
Isn't that what happened in the 1918 flu? It burned itself out.
It kind of burned itself out, right? And so now, if it's really triggered a full-fledged autoimmune disorder, you're probably going to have it. But it may be more like Nancy's experience with MS, which is, waxes and wanes and doesn't keep you. You seem to be a very vital person, Nancy. So it's not keeping you from being, successful in your life and living a good life, if not the best you could have had if you didn't have that, right? So we do, we're survivors. We take advantage of what we have. We deal with what we don't have most of the time. And I think we really are going to be seeing, probably a year from now, we'll have a lot more information on the long-term stuff. If everybody that gets it still has it, if everybody that gets it falls into a certain category or not, that kind of thing. Yeah. Kind of like some of the other things that we've seen come up from Lyme disease, for instance. That's a weird one that is pretty unpredictable.
So what, in thinking about what our experience might be and what actions we should be taking now and in the future, what do you think we'll be looking at kind of for the rest of the year in terms of COVID?
Yeah. So there's a lot of questions. I think we need to still protect ourselves no matter how we do that. Even if you're fully vaccinated, just be careful where you go and who you're around. If you've been in a more crowded situation, and I think, Michelle, when you have a lot of people that you're working with who aren't vaccinated, then you as an advocate probably have to be more careful than you might if you weren't working with all those folks. But it wouldn't mean that even if they were vaccinated, that you wouldn't be more cautious because you're working with vulnerable population. And I feel like that's how we have to do, whether it's our family members or whether it's who we see at work. That surprised me about work. I don't have any direct patient contact, but I must wear a mask when I'm in the hospital. when we're walking through the halls of the hospital, we have not changed that yet. I'm hoping eventually we can, because we miss seeing people's smiles and things like that. But so I think some of that will change over time. People will be able to do more. Businesses will slowly come back. Some not the same. And that's super important. And then we will hear before the fall about whether we should have a vaccination, another one. About we're worried about the flu season. We're really worried about the flu season because we didn't have a flu season this last year. So, and you may know that when they do the flu vaccine, they redo it every single spring based on last year's mutations. So we don't have last year's mutations because we hardly saw any flu, because everybody was wearing a mask and staying home and washing their hands. So that for Michelle's population, you can't emphasize those things any more than, than you could just say it in a nice way every day. But so we're worried about what we're going to get for the flu season and whether the flu vaccine will even cover what shows up.
So do you see us having any like surges or breakthrough that would require, additional lockdowns or things like that?
I wouldn't be surprised. I mean, some of these variants that are hitting are causing, right now they seem to be in our country in communities. But we're a very international country and a very international people, even if you don't personally travel outside of your immediate area or outside of your state, a whole lot of other people are. And we've already seen it with people just need to get away for vacation, let alone business travel picking up and planes being fuller and those kinds of things. And people get tired of wearing masks, and people are doing things that don't make a lot of sense, eating or drinking, and you're this far away from somebody.
Right.
So those things are going to make a difference if we get one of these variants that are super transmissible. But I'm hoping that those are going to be finite areas. And, different parts of the country shut down more dramatically than others. And we still see our biggest areas of infection in Southern California, parts of Texas, parts of Florida, a little bit in the Northeast. So, and those, some of those were areas that kind of declined shutdowns or did them very, very late, and some of them are not. So I think we just have to be watching.
Margaret Buckley Brown had a comment to make.
Hi.
Hi, I didn't realize my full name was up there. Most people know me as Maggie Buckley. So I spent the weekend in some research meetings with researchers and clinicians from around the world, actually, having to do with the constellation of conditions that people with connective tissue disorders have, Ehlers-Danlos syndrome, and dysautonomia, mast cell dysfunction, et cetera. And so what they're finding is that people with diagnosed mast cell dysfunction prior to 2019, who have been on the treatments and adhering to that, if they do get COVID, they are much less severely affected, myself included. And dysautonomia, all of the dysautonomias, the COVID, because it's a virus, as you said earlier, Dale, it triggers things like dysautonomia. All of those are usually a condition that's a post-viral consequence, and it may be short-lived, it may be long-lived, et cetera. So part of what we were talking about this weekend is the excitement that we have more research dollars available for the dysautonomias because we qualify under the long COVID research in there. So if you search out the organizations for mast cell, TMS for a cure, put in the chat or send it to Robin to send to all of you. There's some interesting information about cytokines and understanding the biology there and how that all works. And if you search out Dysautonomia International, that gives you a whole bunch of resources for your patients when you're dealing with long COVID, and if they've got POTS and some cardiac issues, et cetera, to help them cope with that, as well as specialists that might be more local.
I think thank you, Maggie, for mentioning that. And I do want to put in a quick plug for people who are on this call that our November 4th and 5th conference will focus on what COVID has taught us about health advocacy. And so I think different areas like the dysautonomias and things like that, we will be posting very shortly a call for speakers. And so let us know, people on the call or doctors and researchers that you know. We're going to put together a very robust conference, and we hope to see you all there. We're right at time, so I just want to say thank you to Dale and thank you to everybody who's shown up today. It's been fun to see everybody after we took a little bit of a break, and we will be still continuing to host these monthly calls. So let us know, what you want to hear about. And Dale, thank you. Any last quick thoughts before we sign off?
I want to thank everybody for your comments and your enthusiastic participation. It's really neat to have a little bit smaller group and have people speak up with their own experience and queries and so on. And that's how we are more successful, is when we do it as a team. So thank you so much. Stay safe wherever you are. And I think we will just keep learning from this, and we'll appreciate your ongoing support for your clients as well as for organizations like ours. So thanks.
Thanks, everybody. Be safe, and we'll hopefully see you soon. Bye.